Morning, everyone. It's good to see you back from the long weekend. Today, we're going to be jumping into a topic that lies at the intersection of business strategy and healthcare management, specifically market concepts, competitive advantage, and the unique challenges faced by nonprofit organizations in healthcare. So, we're going to look at terms that may be new to you, but the concept, we interact with it on our daily lives. The more competitive advantage a company has, the more it can outperform its rivals. Think of big box stores. What makes them so popular? Why do you go? Why do I go? Well, because there's lots of locations. It's convenient. There's low prices. I can get tires and baby food all underneath the same roof. And that's what makes them stand out. That's what makes them success. That's why in the business world, the competitive advantage concept is key to that success. So let's start with some of the foundational definitions. In the context of business, market concepts include ideas such as market power, market share, and market differentiation. So, market power refers to a company's ability to influence price in terms of products, like I mentioned before. And market share, that's the percentage of an industry or market's total sales that's earned. So, they look at data over a specific time, and that sort of helps determine that. And market differentiation, that's basically where we're going to focus today because it's a company's ability to stand out. We want, as a healthcare business, for our patients to do well. We are looking for that positive patient outcome, but we're also a business, got to keep the doors open. So how are we going to do that? Well, through lower prices, better service, brand identity. So these concepts are closely tied to the idea of competitive advantage, which is, again, having that edge over your competitors and allowing it to generate greater sales and customer loyalty. So Michael Porter, a key figure in this field, identified three primary strategies for this competitive advantage, including cost leadership, differentiation, and focus, which is what we're going to look at first. So in healthcare, the application of competitive advantage is more complex. Traditionally, healthcare organizations might seek competitive advantage by offering superior services, achieving better outcomes, or operating more efficiently. Cost leadership in healthcare could mean providing high quality care at a lower cost, potentially making a hospital more attractive to insurers and patients. So, differentiation might look like or might involve specialized services like advanced technology or a reputation for excellence in a certain field. Just think about some hospitals that maybe don't have a great reputation. We have some in our area. They call them gunshot hospitals. I know that sounds weird, but they tend to be in bad neighborhoods. And the thing is, though, they offer low cost. They have a bad rap. But if you were to sustain a GSW, where would you rather be? In the nice, beautiful facilities that only see one or two a year, or the leading trauma unit here in the greater Houston area? Exactly. So, focus could also involve targeting specific patient demographics or geographic locations to become the preferred provider, which is what some of our more expensive facilities do. They go to nicer regions, they have nicer looking waiting rooms, reception areas. However, these strategies can have some unintended consequences. For instance, hospitals that successfully differentiate themselves might affect or might attract more affluent patients, leading to disparities in care. And we have seen that. We see that in the greater Houston area all the time, where you'll have a beautiful facility that unfortunately doesn't cater to people right down the street who can't afford those services. So those that's able to compete might otherwise receive lower quality services. And those, again, create inequities in healthcare. This is particularly concerning in healthcare, where the stakes are human lives, not just profits. So, what happens when the dynamic is applied to healthcare organizations that have a mission to serve disadvantaged communities? And how does this competitive advantage align or conflict with their mission? So, we're going to look at the nonprofit world here as well. And in 2003, the health services research showed that unlike for-profit entities, nonprofit, are mission-driven, often aiming to serve disadvantaged and underserved populations. As I said, this mission can sometimes conflict with the traditional pursuit of competitive advantages. They're not against money, but they do have to look at it from a different perspective, and they have to come at it from a different way. For example, if a nonprofit focuses on solely competitive strengths, it might be tempted to prioritize services that make more money. So, potentially at the expense of providing care to those who can't pay. A 2020 study conducted in the Journal of Healthcare Management concluded that this could undermine the hospital's mission and lead to a situation where the most vulnerable patients are left without adequate care. On the other hand, if the hospital doesn't pursue competitive advantage, its risk becoming less efficient, potentially leading to financial instability and reduced service quality, possibly even closing and now leaving a demographic area without further access to healthcare. So, how are we going to navigate those waters? Well, how do nonprofit healthcare organizations maintain or remain competitive? Well, first, they need to balance financial sustainability with their social responsibilities. Strategic management practices suggest that forming partnerships with local governments or other healthcare providers can be a very effective way to share resources and expertise. One approach is to leverage community partnerships. By collaborating with local organizations, nonprofits can share resources and expertise, allowing them to offer a wider range of services without the same level of financial strains. Another strategy is to pursue grants and government subsidies. These funding sources can help cover the cost of providing care to underserved populations, allowing the hospital to maintain its mission without sacrificing financial stability. Again, finances, finances. We got to keep those doors open. And without that operating budget, we can't care for those in our community. So, nonprofit hospitals can focus on operational efficiency, implementing process improvements that'll reduce waste and lower costs without compromising care. For example, many nonprofit hospitals adopted the lean methodologies to streamline their operations and enhance the quality of care. Not to get too technical, but lean is a set of principles and methods that originated from Toyota, of all places. So we went from cars to healthcare and back to healthcare again. Lean in healthcare emphasizes the needs of the patients. And how can we do that? Well, we can reduce waste. And I'm not just talking about trash and our carbon footprint. I'm talking about non-valued activities such as long wait times, or improve efficiency by streamlining processes, including resource allocation. What will really help them stand out from the crowd is if they can enhance patient experience by providing timely, efficient, and personalized care. You might have even seen some local facilities promote shorter wait times in their ER or share patient testimonials to get that point across. So that comes along with branding. And they can also improve quality of care by standardizing those procedures, which can minimize the risk of errors. Of course, increasing productivity would also help healthcare professionals to focus on tasks that directly relate to contributing to patient care. Again, it's that patient outcome. How do we get them the care that they need in a timely manner and make sure that everyone has access and that we're still meeting that bottom line? So, we want to reduce operational cost. And to do that, we're going to have to serve a larger patient population while maintaining or improving that quality of care. And this can all be done by creating an innovative culture by engaging employees, such as you, when you get out there, or maybe some of you guys are already in the field. But in healthcare manage, we have that, or we're charged with that responsibility. So let's look at a couple of cases. Let's consider the example of Kaiser Permanente. They're a nonprofit, and they've successfully balanced competitive strategies with their mission by integrating healthcare delivery with insurance, allowing it to offer high quality care at a lower cost. They have also been invested heavily in preventative care, reducing the need for expensive treatments and helping to keep healthcare affordable for all patients. Another example is St. Jude's Children's Research Hospital, and they operate on a no cost basis for families. They navigate financial sustainability through a strong fundraising arm. You may have seen their different charity drives, fundraising drives, and with partnerships, maintaining their mission of providing care regardless of the family's ability to pay. So, quick recap: a competitive advantages is what your organization does to better themselves against similar organizations. Let me say it again. So, what does competitive advantage mean in your organization? Well, it gives you that advantage over similar organizations, your competitors. This is why many organizations in the nonprofit world think that they don't have any competitors. But the truth is that nonprofits find themselves actually competing for a small pool of resources. They're competing for the same money, the same volunteers, and they're competing sometimes for the same grants. So, competitive advantage is critical in today's market, whether you're for profit or nonprofit. So, how do you begin to identify your competitive advantage? Well, start by asking questions like, what are you best at? Or what could you be best at? What makes your organization unique? Why do people donate to your organization? Or why do people volunteer for your organization? Let me wrap this up by saying that while the concept of competitive advantage is essential in the business world, its application in healthcare, especially amongst nonprofit organizations, requires careful consideration. Nonprofit healthcare providers must balance the need to remain competitive with their mission to serve the disadvantaged. So, through strategies like community partnerships, securing grants, and improving operational efficiency, nonprofits can navigate these challenges successfully. However, this requires a commitment to their mission and a deep understanding of the unique dynamics of the healthcare market. So I encourage you to reflect on how those concepts apply to your current or your future roles in healthcare management. Understanding the balance between competition and mission is crucial for leading organizations that I'm hoping that you'll lead. And it's what makes the difference. Be sure to do the chapter reading, and pro tip from me: skim the following references. I provided the links with their DOI, make it a little bit easier for you to find. And I'll see you next week where we'll explore more cost advantages in healthcare. Feel free to reach out to me if you'd like more insight on the topic in preparation for your capstone project. See you in the hallway.